Hi, and welcome to the Madigan Intensive Care Unit. We'd like to take a few minutes to talk to you and your family about post-intensive care syndrome, or PICS, and what it means for you and your loved one. Any stay at an intensive care unit is a very troubling time for both the patient and his or her family and friends. At least 1/3 of ICU patients will develop PICS, which is a cluster of health problems that develop both during and after the patient's critical illness. Even close family members can experience physical and emotional symptoms such as anxiety, depression, and extreme grief. Sometimes it can take a patient over a year to recover from PICS. Friends and family are especially wondering what they can do to help their loved one recover.
The onset of PICS can be caused by a number of factors related to critical illness, such as pain or delirium. The result could be mental, emotional, or physical symptoms. Some patients will have memory or brain dysfunction and have difficulty remembering, paying attention, solving problems, or maybe organizing and working through complex tasks. Still, other patients may have trouble falling asleep or staying asleep. They may have nightmares or unwanted memories. Patients may feel depressed and anxious and show symptoms of having post-traumatic stress disorder or PTSD. In addition to mental and emotional problems, some patients will develop severe muscle weakness, which can make daily living very difficult. Things that we normally take for granted, like grooming, dressing, or bathing, can become quite challenging for patients or family members with PICS.
Here at the Madigan Intensive Care Unit, our ICU team does everything we can to help prevent and treat PICS. One of the goals at the Madigan ICU is to decrease the amount of sedation that our patients are receiving. Each morning, if it is medically safe and comfortable for our patient, we perform what is called a sedation holiday, and we slowly decrease the amount of sedation medication that our patient is receiving. Our nurses will also assess for pain, confusion, and hallucinations at this time. The family can assist with providing frequent reorientation to the day of the week and the time of day. Nurses will also focus on maintaining a proper sleep-wake cycle, and our goal is to provide our patients with at least 2 hours of uninterrupted sleep each afternoon and during the night. Depending on the type of ventilator support that the patient requires, the ICU team will also encourage our patients to try and breathe more independently with the goal of safely removing the breathing tube.
Keeping our patients moving is critical to preventing ICU-acquired physical weakness. Our staff turns patients in their beds frequently to help prevent skin breakdown. We also perform exercises in bed to attempt to get the patients moving as soon as possible and when they're safely ready to do so. We will rely on the physical therapists and other resources to assist with our progressive mobility plan.
There are a number of ways to both prevent and treat PICS. One way is through a tool called the Madigan ICU Patient Diary. Using a diary during an ICU stay has proven to decrease the symptoms of PTSD. Many ICU patients have reported the loss of factual memory, so using a diary to recall past events can be very beneficial in filling in memory gaps for both the patient and family members. ICU diaries can also help ground their experiences in reality by distinguishing from factual or delusional memories. After leaving the ICU, reviewing the diary helps patients to understand the severity of his or her illness. This can also be done while still an inpatient on another ward.
Family involvement in the diary process is highly encouraged. We recommend that you write in the diary about current events like news, weather, maybe the sports, or updates on what's happening at home. Another great topic to write about is the patient's progress, treatments, and daily events at the hospital. Words of encouragement are also helpful things to jot down in the diary. Any topic that can assist patients in remembering past events or calms their anxiety and nerves is good content to add to the ICU diary. The goal is simply to help the patient adjust back to home life after he or she leaves the ICU and the hospital.
The ICU station also has a camera available for checkout, and photos are a great addition to the ICU diary. To check out the camera, just ask an ICU nurse. Post-intensive care syndrome can be a very discouraging side effect after an ICU stay, but Madigan Army Medical Center is here to support the short and long-term health care needs of all of our patients and their families. If you have questions about PICS, the ICU diary, or general hospital questions, please don't hesitate to ask your nurse or doctors. Thank you for choosing Madigan to provide your care. Serving to heal, honored to serve.